Let's be real. Medical students, residents, and fully practicing doctors sometimes have difficulties in their relationships. This video is for people who are not just doctors, but fit the following criteria. One is they're in high-pressured positions of leadership, and two, they are accustomed to prestige and people following orders.
You know, doctors give orders. That's actually part of their profession. They write orders in the systems. There aren't many professions that you give orders except if you're in the army. So language counts. What does that mean that you give orders? What does that mean that you have the responsibility to give orders? How does it affect you in your everyday relationships where people don't necessarily want you to fix them or need your orders, but want you to be with them, to work with them, to collaborate with them, to listen to them?
Doctors and others in these high-pressured kinds of positions have unrelenting demands to make very difficult decisions on a constant basis. There is no space or room to have feelings, to be attuned to feelings, because what would happen if you have a patient in the ER or in the operating room and you get overwhelmed by what's happening with the patient and you start to notice your feelings? You can't just melt into a puddle. You need to make those hard decisions and then move on to the next patient. You cannot take 2 hours to sit in the doctor's lounge and cry and grieve for what's happening. And it is a very helpless and powerless feeling. The patient is helpless and powerless, the families are helpless and powerless, and you can feel helpless and powerless. So the feelings are a liability at these kinds of jobs. Whereas in your relationships, in order to be successful, you need to be attuned to your feelings and to your partner's feelings. So what happens then? How do you have a successful relationship when you're so accustomed to shutting off your feelings?
That's why it's so important to make time for transition between your work and your home, because the same skill set doesn't work in the same way at work as at home. You have to be very careful to somehow change gears and be a different kind of person, one who doesn't necessarily give orders. You know, in this kind of work, you are going to need to work beyond your regular hours. Be on the phone, talk to supervisees, be on the phone, talk to family members of patients. But don't walk into the home on your phone. If need be, finish the phone call, finish the texting, finish the email outside. Walk into your home and take a few minutes before you get back on the phone again. Get reacquainted with yourself and with your spouse and with your family members.
One thought is to think of it like a transition period between work and home. So for example, if you're on the train or in your car, you can even sit in the driveway for a couple of minutes and think about each member of your family. Your spouse, if you have children, think of each one separately. If you have a dog or other pet, think of your pet. And one positive quality of each one. That can help soften your mood from a highly intellectual, high-performance mode to a place of open-heartedness and flexible and empathic state of mind.
When you come home, you have to be in a different place. You need to apply a different skill. So when you're at work, you need to give care with your intellect.
When you're at home, you need to care with your heart.